Jennifer. I am the nurse at the Student Health and Wellness Center. I do a lot of health education, and this today presentation is about all you need to know about safe sex principles. I have been here for 9 years. I've been a nurse for 1977, so you do the math. I have no idea anymore. That's how much I've been doing this. So what I think is a good idea is that if you know how to get pregnant, you know how not to get pregnant. And my goal is about prevention and wellness and safety. So I want to teach you how the body works, how you do get pregnant, so you know you don't have to go there if you don't want to go there. Because I think most of us going to college right now want to put off an oops. Oops is an unsafe pregnancy event. You don't want that. I went back to school to get my teaching certificate when my youngest one was 1. So hard, because I put him in the playpen, and you're looking at me, I'm like, I just have to write this classroom presentation. Just hang on an hour, just hang on. It's too hard. So the best to put that off if you want till you're all done and you can enjoy it. So based on what happened to me, I'm going to teach you everything you want to know. Is that good? Informal, shout out. All right? Okay, so we're going to start out with a little anatomy and physiology. Again, this is upsetting. Go like that. You don't have to watch. Okay, I do a little booklet. I wish I could get this bigger, but this is as big as I can get it from the manufacturer. This is on a PowerPoint slide, and I will show it better, but I need just to do this and this to show you. Everybody has a first day of their menstrual period. Guys, sorry you don't have a menstrual period, but women, everybody has a first day of your menstrual period, because everybody has different ending days. Some are 2 days, some are 3 days, some are 4 days, some are 5 days. Some are 7 days, but everybody has 1 day. So we're starting out on day 1. That's what we start counting on. So day 1 of your period, the uterine lining starts to shed. Can everybody see this, or do we need to dim lights? You guys okay? This is day 1 of your period, what your ovaries doing. If you had your period once a month, regularly, on day 1, this is what you would look like schematically. Okay, so let's do a little anatomy and physiology. This is your urethra, women, where your urine comes out. This is your bladder, where your urine is stored. This is your vagina. This is your cervix. This is your uterus. Fallopian tubes too short. That's your ovary and an egg. And this is your intestine where your stool comes out. Okay, one part I want to emphasis on, I know this is a sociology class. I know you talked about interactions. Clitoris, right there. Dry sex for a woman is terrible. If this is not stimulated and the vagina does not get juicy, whoa, that's uncomfortable. I talk about this because I want both people walking out of that sex going, wow, that was great. Not one person, but both of you should get everything out of it that you wanted to get out of it. So what happens is, everybody know the definition of intercourse? Here's my definition of intercourse. Communication. You know there's a town in Pennsylvania called Intercourse, PA? People would go there all the time to get their envelope stamped. Intercourse, PA. It's about communication. So you have to do this first before you do this. So you have to talk and say, I want you to touch me here. I want you to do this. I want you to kiss me here. I want you to do this. I don't want you to do that. If one of your partners says, I don't want you to do that, can you do it? Can you do it with alcohol? If someone says no, no is no. Good? That's my principle. Okay. So both of you should enjoy this. So with women, it takes a little longer to stimulate them. Men, you get a response, that's great. You see something that, wow, you're ready to go. Women, take a little longer. Because what do we have going on in our brains? Okay, so the lights are out. You're about ready to do it. If you have this conversation going on in your brain, oh my God, I'm going to fart. Oh my God, he's going to think I'm fat. Oh my God, why is the light on? Oh my God, where did he learn that from? Oh my God, was his last partner better than me? I don't know anything. If you have this conversation going on, this is not going to get ready. We're men are, I'm ready to go. What what's your problem, right? So you have to work on getting warmed up mutually. Good? Good. I'm moving on. Is that okay? Okay. So, where are we? Okay, so, if this is day 1 of your menstrual period, somewhere, if you're regular once a month, somewhere 2 weeks from the first day of your menstrual period, that ovary is going to kick out an egg. Okay, 2 weeks from your first day of your menstrual period. Should I do that again? 2 weeks from the first day of your menstrual period is when you should be ovulating. Should you have unprotected sex when you're ovulating? No. No, okay. So around 2 weeks, that ovary is going to kick out an egg. It's going to start heading up there. If there was no oops is an unprotected sexual event, between those 2 weeks, actually it starts 9 days. 9 days from your first day of your period to 20 days is the zone when the egg is out and about. If the egg is out and about, can you get pregnant? Yeah. Those are the light gray zones. If you see, it's not. I know it's small. I apologize. Day 9 to day 12 and day 17 to 20 are possible fertility zones. What that means is that the sperm can lay and rest in the woman's body and ready to attack whenever. But peak fertility is the 2 weeks, 13 to 16 days. Peak fertility. Peak. Everybody have those dates in mind? Okay. So somewhere in that peak fertility zone, 13 to 16 days, that ovary kicks out an egg and starts its going. If there was no oops that month, no unprotected sexual event, no sperm making it up, that ovary is going to go down, the egg is going to go down through the tube, down through the uterus, to the cervix, to the vagina, out the door. The uterus is going to communicate to the ovary via hormones and say, hey, our job, the reason why we exist is to get pregnant. I didn't get pregnant this month. I spent all month long building up my uterine lining with tissue and blood vessels to get pregnant. That didn't happen. I can't save it for next month. It's going to go stale. So I got to get rid of it. So here comes the cramping, here comes the bloating, here comes the period. Now the uterus talks to the ovary and says, you know why you exist? You exist to afford me the opportunity to get pregnant. So I need you to kick me out another egg next month so we get another opportunity to get pregnant. So that's why the very first day of your period, the ovary says, okay, I'll be the dutiful partner. I'll select an egg, I'll grow it to maturity, and I'll out-pop it. When? 2 weeks, around 2 weeks from your first day, it takes to mature that egg. So out pops another egg. All right, let's tell another story. Let's say there was an oops this month. Let's say sperm made it all the way up and hit the egg. What's the sperm and the egg's job when they get together? They have to duplicate. 2 cells become 4 cells, become 16 cells, become 24 cells, become 64 cells. Boom, they need 100 cells before they can embed themselves in there. This process, depending on where the egg and the sperm meet, takes 3 to 5 days. Okay, so we have 100 cells of blastocysts in the lining. Now the uterus says to the ovary, remember they talk, via hormones, hey, I got a muffin in the oven. Our job is done. I'm pregnant. I'm not going to have a period next month because I like what's growing in there. Why would I want to get rid of it? I'm going to not have a period. Says to the ovary, our job is done. Go take a 9-month vacation. I don't need you. You exist to afford me the opportunity to get pregnant. I'm already pregnant. I don't need you. Take a 9-month vacation. Go to the islands. I don't need you. So it's asleep or dormant, right? How do we know these things are true? Okay, I'll tell you why. What's the first thing you miss when you're pregnant? Period. Yeah. Why do you miss your period? Because it likes what's growing in there. Doesn't want to get rid of that. How do we know this is gone? Dormant. A little harder. People who are pregnant still have sex. How can you not get pregnant when you're pregnant? Because there's no egg. So no egg equals no baby. Oh, is that a good thing? What do? When we give you hormonal birth control, we're copying that hormonal message. Because if there's no egg, is there a baby? And when you take birth control, do you want a baby? So no egg equals no baby. So that's where we give you birth control. Now, it doesn't matter how we get that birth control in you, it's about your lifestyle. There are many different methods. I'm just going to get some toys out. The most common one, pill, right? Everybody's seen the pill. This hormone, you take it every single day, same time every day, because it's bathing this in pregnancy hormone, and the uterus is really happy. One every day, no egg, no baby. There are other methods about your lifestyle. There's NuvaRings, there's implants. This gets implanted into your upper arm. We have that. We have IUDs that get implanted into your uterus. Sits there, works for 5 years. We have other wonderful methods. So if you're ever wondering what method to get on, come down, we'll talk to you about it. No problem. But whatever hormonal method you use, I really want you to use a condom with it. Because if you noticed or heard, there is no 100% birth control. How many people have heard stories that, oh, I know my girlfriend got pregnant on a pill? Yeah, it happens. If you had a perfect person and is taking that pill perfectly well, same time, every day, never missing a pill, 1 out of 100 women will still get pregnant. Why? Because we're faking the body out thinking it's pregnant with that hormone. And that one poor person out of 100 has a very smart ovary and smart uterus that says, I ain't falling for that trick. I know it's a trick. My job is to get her pregnant, that's why I exist, so I'm going to kick out an egg. Now, how many people know they have a smart ovary and smart uterus? Who knows? So how do you move that closer to 100%? Yeah. Okay, I call condom garage doors. I relate them. Why? What happens to garage doors? They go up too soon, they go down too soon, people back in them, there's holes, they rot, right? Condom. Garage door. They can go on too late. They can open too early. They can rot. People got holes in them. But a garage door is a great backup system in case one of these ovary eggs escaped and you don't know it's escaping. So if you really don't want to get pregnant right now, use a hormone and garage door it. Now, we have like 10 ways for a woman not to get pregnant. Hormones, barriers, we have all sorts of stuff. How many do we have for men? So, guys, all you guys want. So the best thing to do is to use that one each and every time you have sex. Because what's the condom is the only one that'll prevent STDs and prevent pregnancy. So you're really important in this equation. You really need to use that condom each and every time. Do you know the condom story? Can I tell you the condom story? Okay. So, there are, help me out, I only know a couple. There's premiums, CRs, Trojans, Durexes, I don't know, others on the market. Lifestyle, thank you. Each manufacturer makes a condom differently. Each manufacturer will fit different bodies, like blue jeans. Blue jeans, they're all blue jeans. You can have a Levi's Relax Fit guy. He loves those Levi's Relax Fit, wears them all the time. He could probably go get into a Gap skinny jean. Wow, is that going to be uncomfortable and can't breathe? But they're still blue jeans, right? Same thing with condoms. Try on different manufacturers to see which one fits you the best. Because you're going to have to wear it each and every time. I don't see anybody nodding with me. Each and every time. Okay. So that's the female reproductive system. That's how you can get pregnant. How do you don't get pregnant? You take away this with hormones. We use condoms to block any. Is that good? Now, if you're really opposed to hormones or you can't use hormones, there are other barrier methods for women. I would do other barrier methods if you can with a condom. The one barrier method for a woman that I would not, you really shouldn't do with a male condom is that you don't want to use a female condom with a male condom. Because they're both like latex and one's going to just slip in and out of the other one. This is a female condom. So it's sitting here like this. Put it in. Person holds it on the outside so it doesn't get displaced. I know, look at the looks I'm getting. I know. Look at this. It is only 74% effective because it could slip. It could go on the side. This one is ripped. They rip. So that's the female condom. You can't use a female condom and a male condom together. That's the only time I don't want to use two methods. Good? I'll pass this around, but you're going to get a little yucky because there's still stuff on it. It's a lubricant on it. Okay, we good? This is it in a smaller version. Because you couldn't see the other one. Okay, this is the story I told you. Around 2 weeks after the first day of your period, release from the ovary. Goes out the fallopian tube. If it is not met by sperm, it passes all the way through the fallopian tube, down the uterus, to the cervix, out the vagina. Now the uterus notices it did not get implanted by the egg and sperm. The uterus then talks to the ovary using hormones to say, hey, send me another egg so I get another opportunity to get pregnant next month. The uterus can't save that line that is built up all month to support life, so here comes the shedding, the bloating, the cramps. Who needs it? Okay. Along with the first day of your period, the ovary is being dutiful and starts getting the next egg ready to go in about 9 to 20 days possible fertilization. We good? Along with the first day of your period, the ovary is being dutiful and starts getting the next egg ready to go in about 9 to 20 days. Peak fertility day is 2 weeks from the first day, if your period is once a month, if it's regular. Oh, here's a good thing. I didn't bring that up. This is based on once a month period. What if your period is 35 days long? You have a 35-day gap between one menses and the next. Is this good? No. We don't know where your reg is. It could be this way, it could be this way. How about if your period is shorter? You have a period every 20 days. It's going to be this way, it could be this way. This is rhythm method. How many babies are born on rhythm method? A lot. I'm born on rhythm method. Okay, so we're good on this? There's that picture. So this is the first day of your menstrual period. Periods are about, average this long. Bless you. This is the egg. If the egg is out and about, can you get pregnant? Yeah. Okay, here's a question. Your question. Suppose the egg is really close to the uterus and the sperm meets it there. Can you get pregnant? You don't have enough time, that 3 to 5 days for those 2 cells to become 100 cells, not going to happen. That's just going to go right down. Can you get pregnant in this time zone with the egg in the uterus? No, it can't travel backwards, so sperm and egg have absolutely no days to duplicate to get 100 cells to make a blastocyst. That's going to go right out. So you can have many fertilized eggs, but they need about 100 cells to implant to be a pregnancy. Plan B! Who knows about Plan B? It's when your Plan A fails, right? That's why they named it Plan B. Wait, is Plan B an abortion pill? Plan B is an old-fashioned birth control pill. When the birth control pills first came out in the late 60s, it's 150 micrograms of hormone. What's today's pill? 10, 20, maybe 30 micrograms of hormone. Wow, that's a big difference. So, a Plan B is just a birth control. Does a birth control pill cause an abortion or miscarriage? No, it does not. Plan B is 85% effective. What does that mean? 15 people out of 100, it's not going to work for them. But if your plan A fails, you get your plan B right away, correct? If you want to avoid a pregnancy. What's a plan A failure? Condom breaks if you're just using condoms. You went away for a week and left your pill back home. You lost 3 days on your pill pack. You've lost your NuvaRing. That's when you probably need plan B. What does plan B do? Plan B messes up this transportation of the egg and the sperm, and it makes the uterus not so hospitable. So when the egg and the sperm are traveling down, if you took a plan B, it's going to go out. It's not going to embed. Not an abortion. It's not embedded. There is an abortion pill called Mispristine or European RU35, which once the sperm and egg are embedded, will cause the uterus to contract and reject and expel. Plan B is not. Plan B is a hormone. Once the sperm and the egg are embedded, you're pregnant. Plan B is not going to do anything. Plan B is extra food for that baby because babies love hormones. Okay, so that's that. We have the pregnancy growing. How do we know this to be true? No egg equals no. Thank you very much. Okay, I'm equal opportunity. What's this picture of? Yes. Okay. This is your testicle where your sperm is made. This is your vas deferens. This is your bladder where your urine is stored. This is your prostate. This is your urethra. This is your intestine. I'm just going to do a PSA for a moment. Prostate cancer. Men. What's the only way that they have to do a physical check for prostates? I hate this. But I got to tell you why. Okay, let's figure out why. Okay, this is prostate. What you're feeling for is if it's encapsulated or if it's hard. Okay. Can you feel through here to get there? No, you got a lot of cartilage. Can you feel through there? No, that's your bone. Okay, what else is left? Sorry. It's right next door. So it's important, it's a health thing. So I just have to explain why the physiology, because some people, why do they have to do that? Well, that is why. Okay, PSA away. Okay, so is there sperm and pre-cum? Does withdrawal method work? It's good to get a neck thing. Yes and no. Okay. Yes, there can be sperm and pre-cum. No, withdrawal method does not work because there's sperm and pre-cum. Withdrawal method. Let's go through withdrawal method. You're in the vagina. I can pull out before the big ejaculate. Well, maybe you can, but what happened already is that the pre-cum, which may have sperm cells in it, are going in the vagina. What's the vagina doing? I'll take that, because that's the job, is to get pregnant. I'll take those few sperms, right? There's vaginal muscles going on in there. So, reason why is because, let's say everything is working correctly. You're all good. Probably the first time you come that night, there's probably not sperm in that pre-cum. Probably. Never say never, never say always, probably not. Now, here comes the big ejaculate. Well, it's released. You can't pee and come at the same time, right? So here comes the ejaculate coming down, and there could be some sperm cells in that said, you know what, I'm too tired to take the first bus. I'm just going to lay here, wait, and take the second bus. So then you relax. Then comes the second excitement of the night. Here comes the second pre-cum. What's going to be washed out the second pre-cum? Sperm from the first time. Yeah. And what's the vagina going? Shit, I'll take it. Yeah. So withdrawal method, does it work? So do you have to use a condom each and every time you have sex? When do you put that condom on? I'm going to say in the next room. No, I'm only kidding. So, but it has to go on before this is ever introduced into the vagina because of that reason. Remember, I lost my heading. But this is the reproductive organs. This is why these exist. You take a reproducer, put them in a reproducer, you're going to get a reproduction that is right. This is what it's made for. So you got to work hard not to if you don't want to. Hormonal versus barrier. We talked about garage doors. We talked about hormones work. Remember what I was saying? There's no perfect 100% method. This is from what men want to know about sex and birth control. If you use no method, you put 100 people in a room, they're all having sex. 85 women are going to get pregnant from no method. What's another no method? Withdrawal. I consider that no method. Okay, spermicides, 29 women out of 100 will get pregnant using a spermicide. I had one sex episode. Male condom, 15 out of 100. Why? Because sometimes there's a problem with those garage doors. They're gone too late, hole in them. If you take the pill, 8. Now, remember how we talked about that one perfect woman taking that pill every single day? That's perfect. We're typical. We're human. Oh gosh, I forgot to take my pill today. Oh gosh, I forgot to take the pill 2 days in a row. That's typical use. And what happens is you lower that effectiveness rate of that pill. But we're human, right? We forget. If you put the IUD in the uterus, you put the implant in the arm, 1 out of 100 still don't get pregnant. Why? Because we're faking the body out thinking it's pregnant, and one person is really smart and has a very smart ovary, smart uterus. So how do you get all these closer to 100%? Use that and a... You know, on my gravestone, I'm going to have always wear a condom. I swear, because I really believe in this. Oh, okay, here are all the methods that are out there. There's a depot shot, hormonal, that you can get like a couple times a year. This is the rod that goes into your arm, hormonal. This is the IUD. There's 3 IUDs now. There's one that lasts for 11 years called Paragon. It's just copper. We wouldn't give it to you too much unless you have a baby, because it's a little hard on you. This has birth control hormones on it. This is called Mirena. This is good for 5 years. They just came out with a new one called Skyland. It's a lot smaller. It's a lot lighter on the contraceptive, and it lasts for 3 years. Now, let's say you're putting that in for 5 years, and you want to have a baby in 3. Can you take it out? Yeah, your physician will take it out. There's a patch, one patch, once a week for 3 weeks. The last week of the month, you take it off. And the 4th week is you get your period. Okay, wait a minute. You get a period on the pill? You get a period when this is off the last week? Why are you getting a period if your body thinks it's pregnant? Still thinks it's pregnant. But we've bathed that uterus in all that pregnancy hormone for 3 weeks. It's happy as could be. We lowered that amount of hormone or took that hormone away that last week of the month, and the uterus is going to get complaining. And it complains by spotting. So it's a hormonal period, pill period. Can you have sex on your period in a pill pack? And a patch, you know, that week you've taken that patch, that pill every single day, first 3 days. Can you get pregnant when you're not taking the pill on that last week of the pill pack? No, because you've covered up that egg production the first 3 weeks. You're pretty safe. Cork. I know. I couldn't find anywhere to look it up. What does the cork represent? Okay. So here's a sponge. That's a barrier method, not hormonal method for women. You can rinse it in a little water, get a little foaming with the spermicide, insert it in your vagina, and it blocks the cervix from getting a sperm. This is the Plan B pill. This is a cap, a cervical cap that works the same way, like a garage door. It is a barrier method, prevents sperm from going on up and hitting that egg. Then we have spermicides, and we have the rhythm method, and that's NuvaRing. And we have a lock, and we have a condom. Okay, we're up to STIs. Before I get that far, I know I'm emphasizing condoms. I really am a firm believer in that. You know, guys, you're shopping around, you found the manufacturer that likes it, and it fits you, because you're always going to have to wear one. If you still hate wearing one, what can you do to make it better? Well, then you're safe sex, kids. I have lube, water-based lube. You can't use petroleum products and latex, because what will happen? Chemical reaction down there burns a hole in the latex. And that latex is right next to your skin. So I'm thinking, whoa, you don't want that on your skin. So avoid that totally and just use water-based lube. So for guys, what are you talking about? I'm talking about when you enroll your when you got your condom in your tip in your package before you roll it on, you could open this up and take a couple of drops of water-based lube in your condom before you roll it on. It will enhance your pleasure. I read it somewhere. I read it somewhere. It's worth trying, right? Women, if this is going on and you had the conversation and it's consensual, you can have a little water-based lube too. Make things better. Be attentive to each other's pleasures. Remember, I like this, I don't like that. We'll do that, we'll do this. Is this, if this conversation is going on, oh my God, I'm gonna fart, I'm fat, oh, the light's on, why is the light off? Why, oh my God, did he do this? Where did he learn this from? He didn't do this last time we had sex. Did he have sex with another person? If this is going on, this isn't happening. Or, ladies, if you're mad at your fella, do you wanna, right? Human nature. So always respect and protect each other against physical and emotional harm. Rough sex, not so good. You both want to go out in that thing going, wow, that was great. And if someone's going, oh, that's not good, right? You both have to have pleasure out of it. What are the two things you worry about when you have sex? There you go. We know about Plan B? Use it within how many? Where can you get Plan B? Any pharmacy? If you have Family Pack, which is a plan in the state of California that believes in paying for prevention of pregnancy, and you're not a millionaire, you can come in and get Family Pack, and Family Pack pays for STD testing, all this birth control, and Plan B, and it'll be free. If not, you can buy it at like Target, Walmart, any pharmacy, anywhere. We've heard from $50 to $60. All right, we're going to the good stuff. This is what's out there right now. Okay, we talked a little bit about bacterial and viral. What do we have to fix bacterial infections? Antibiotics. What do we have to fix viruses? We don't have anything. We have an antiviral, which is a medication that will suppress it, but it won't get rid of it. I think the reason why you could say, like, I demonstrate it like this. Do you remember when you were a kid and there was a race between a rabbit and a tortoise? The rabbit would go and the tortoise would go like this, right? Bacterias, to me, are like the tortoise. They're going so slow that we could find out what kills them. Sorry to say that to the tortoise, but repeat it. But what kills them? Where viruses are like that rabbit. They're just going, and they're morphing so much. Bacteria's starting to morph now too, but they're going so fast, they're replicating so fast that we can't get anything to kill it like an antibiotic kills the bacteria. Antivirals will suppress it. So, herpes virus. Your first outbreak of herpes will be your worst. Let's say you get 10 sores down here. Your body will try to take care of the virus, so the next outbreak you might get 7. You take an antiviral like Valtrex or Valcyclovir, you may get 1 or 2. What is that saying? You got that 1 or 2 when it comes out your whole life long. So we can't get rid of it. Human papillomavirus or genital warts. There's 100 strains of human papillomavirus. 4 of them cause cervical cancer. There is a shot now called Gardasil. There's another one called Cervarix. The Gardasil covers the 4 that cause cervical cancer. Cervarix covers the 2 of the 4 that cause cervical cancer. And you can get that so you don't get cervical cancer. It's a series of 3 shots. And you can get it from your insurance company, or if you don't have insurance, you can get it down in the health office, providing you're not millionaires. Because Merck is the program that makes Gardasil, and they have a free vaccine program. So you can get immunization so you don't get that. Yes, spread during vaginal or oral sex with someone with disease affects both men and women. Symptoms show up 7 to 28 days after having sex. Most women and some men have no symptoms. This is important to know because sometimes I have someone come in on a Wednesday and said, oh my God, I had protected sex with this person in the bar. Well, it may not show up, right away. There's the symptoms of chlamydia: discharged vagina, bleeding between periods, burning, pain, urination. Men, burning. And that's showing how the fallopian tube is getting blocked by scar tissue from the chlamydia. That's a treatment. Easy. Gonorrhea. How you get it? Vaginal or oral sex. Someone who has gonorrhea affects both of men. Now this is a little different. 2 to 21 days. A little more painful. Okay, pictures. Close your eyes.
You're okay.
Yeah. Okay. Herpes. How many Americans have genital herpes? Saw that little slide. 25% of women, 20% of men, equals 50 million. 85% don't know you have it. 1 to 30 days. Some people have no symptoms. Flu-like feeling. That's what we're talking about. Sometimes they go away. And that's what they look like. Sort of fluid filled. As a different to a wart is more tissue, more filled. There is another one out there that sometimes people have. They're just one or one here, and they're gray. They look like pearl color, called molluscum. That's a virus, and it goes away on its own. You could get it. Because some people come in thinking they have herpes when they only have one, and it ends up molluscum. No treatment because it's a virus. And take valcyclovir, antiviral. AIDS. Can you share toothbrushes? If your partner and you've never tested for HIV, don't share toothbrushes, because sometimes when you brush your teeth, what do you get? Bleeding gums. Person picks up that toothbrush, puts it in your mouth, might get bleeding gums. We can burn off warts. We can burn them off. And that's what warts looks like. It's a full, see, there's not a liquid in there as a difference to herpes. You could see like there's tissue here rather than liquid. Most HPV goes away on its own in about 2 years. Your body takes care of that virus on most people. And there's the stuff that you could use to burn it off. You can also freeze it off. Here's my thing. That can't be pleasant. Can't. So why don't we just step those 3 steps to this way and always use a condom. Thank you. Syphilis, there you go. Syphilis, viral or bacterial? How do you treat it? And, hopefully no one ever gets to second stage. Because once you get your first symptom, you're going to go get a shot of antibiotics and you won't get this. There's also tertiary stage. This is showing the rash and the sores of syphilis. Oh. Oh. We talked about that. When were antibiotics invented? Were these people around? Now, Capone was, I think, I don't know, but maybe in jail. When was he during the Prohibition or something? Whenever you get treated for an STI, just restrain for the 7 days or until all your symptoms go away so you don't get back to your partner. Well,